Hey guys, how's it going? So this is a demo of all the terminology for Human Anatomy and Physiology 1 for the muscle unit for lab. So this will include all the every muscle that you need to know, as well as some of the actions of some of the muscles as well. All right, so we'll start with the head here, and this muscle here is the frontalis. That's the frontal bone, frontal lobe for the brain. So this is the frontalis, and and this muscle raises the eyebrow. When this shortens, it raises the eyebrow. So the frontalis raises the eyebrow. On the posterior side, you have it's not showing all that well, is the occipitalis. The masseter or masseter, that's this right here. This elevates the jaw, elevates the mandible, the masseter or masseter. And you have your orbicularis oculi. This closes the eye, like winking, orbicularis oculi. And you have another sphincter here, orbicularis oris. Orbicularis oculi, orbicularis oris. And this, when this contracts, it tightens and gives you that kissing, or like puckers your lips. So that's your orbicularis oris. You also have the zygomaticus major, and that's this right here. And you see how it's attached to the zygomatic bone, as well as the corner of the mouth. Well, when this contracts, it allows you to smile. So this muscle allows you to smile, the zygomaticus major. And your depressor anguli oris depresses the corner of your mouth, and so you frown. With this, you frown. Zygomaticus major, depressor anguli oris. Down on the neck here, this is the sternocleidomastoid. The sternocleidomastoid. That's all this right here. When both contract, on both sides, left and right, it flexes your head. It flexes your neck or your head. When one flexes, now not one side, not the other, you get that lateral flexion, left or right. But when both, it brings your head forward, anterior, and for flexion of the head. And the levator scapulae is the levator scapulae will be this muscle right here. This is the levator scapulae here. Levator scapula. It elevates the scapula. Elevates the scapula. It's a deep muscle there. On this model here, you see you have superficial muscles. Everything on this side is all superficial muscles, and everything over here is all deep. You can even see that there's been a cut, an incision. And the same thing over here. All these muscles here are all superficial muscles. And if you take away these superficial muscles here, you'll find the deep muscle to those superficial muscles on this side. So that's the levator scapulae. Okay, so let's put this away. That's all you got to know on this here. Then next we have the deltoid. That's the shoulder. Here's the deltoid right here. Deltoid. And you look at the posterior side here. We have here this is the trapezius. It's in a diamond. It starts up here, all the way to here, all the way down 3/4 down the back is this superficial muscle. And of course you can't see it on this side, but you can imagine. That is your trapezius. And all the rest of this from here all the way down, all the rest of this is your levator scapulae. Sorry, your latissimus dorsi. So between the latissimus dorsi and the trapezius, you know, those two superficial muscles cover 90% of all the back. You just have a few here that are peeking out. So trapezius, that's all this and all this. And this is the levator scapulae. Sorry, latissimus dorsi right here. Okay, we also have rhomboid, so deep to that, we also have the rhomboid minor and rhomboid major. And you could just see that this is a smaller one and this is a larger one. Rhomboid minor, rhomboid major. All right, so on the shoulder then, you see here's the spine of the scapula. I will put this away, and here we are. Here's the shoulder, right here. Oh, this is the posterior view. You have your supraspinatus. Supraspinatus. Here's the spine of this of the scapula. So this is the supraspinatus, and all of this is the infraspinatus. If you remember the fossas, this is your supraspinous fossa and infraspinous fossa. So this is your supraspinatus and infraspinatus. And then, and that's from here all the way down to here. All of this is your infraspinatus. Then you have these two last ones here. So there's 1, 2, 3, 4. These two last ones, these are your teres. Teres minor, teres major. Just like on the rhomboid, the minor was first and the major, minor was first and the major was lower, was inferior. The same thing, you have your teres minor and your teres major in that same order, superior and inferior. Okay, so this is your supraspinatus, infraspinatus, that's all of this, and then your teres minor, teres major. This was your deltoid here, and so that covers this whole shoulder here. And all of this on the back is your subscapularis. Subscapularis. Okay, very nice. Now, back to this model here. All right, so here on the chest here, we have the pectoralis major and pectoralis minor. Pectoralis major, pectoralis minor. We have serratus anterior. We turn like this. This is your serratus anterior. Just lift up your arm. You know, you're tickling someone. Lift up your arm, and this is the serratus. Now, it doesn't look all that serrated, but that's because you don't have the rest of this. You know, the rest of your muscles put together. You put everything back together, and look. Here's your serratus anterior, and look. In fact, it is serrated like a knife, like the teeth of a knife. Serrated, and it's just under your arm. You know, sometimes you lift up, someone lift up their arm and you can see their ribs. Looks like you can see their ribs. Well, what you're looking at is the serratus anterior. You see kind of like those bumps, and they do in fact line the ribs. If you see there, lines the ribs. All right, so that's your serratus anterior. Now, the other one, when you put it all back together, this one here then is your external oblique. This is your external oblique. You see the muscle here, and you see its connective tissue here. So if you take a look, you know, the muscle isn't here. You don't see it. That's because this is the connective tissue for this muscle. So this is your external oblique. Hands in your pockets. Just like you're putting your hands in your pockets, it's going this direction. As it goes medial, it also goes inferior, hands in your pockets. Whereas the internal oblique. This muscle is your internal oblique, and as it goes interior, the fascicles go superior. You see the difference? This is your external oblique. If you take all this away, a little bit deep to that will be your internal oblique. And on the inside, then turn this around. This is your transverse abdominis. Here is your transverse abdominis, and your 8-pack, 6 above the belt and 2 below the belt. This is your rectus abdominis. Erect, rectus abdominis. Rectus abdominis and transverse abdominis going this way. Okay, very nice. Let's go back to the arm. All right, so this is the left arm. Kind of take a look. This is your left arm here. And so if you're looking down at your arm, we could do it that way. If you're looking down at your arm, this is your biceps brachii. Biceps brachii. And if you turn just a little bit, so the action of the biceps brachii and the brachialis here decrease the angle of the elbow. Okay? These muscles decrease the angle of the elbow. They flex the elbow. Biceps brachii, brachialis. This one here, brachioradialis. And there's your thumb. See the split right here? We're gonna work our way this way and go all the way around. You see the split right here? Here is your ulna, and under here is your radius. Okay, so one more time. Biceps brachii, brachialis. And just follow your finger. Brachioradialis. There you are. Now to finish all the rest of the upper arm, all the rest of this are your triceps brachii. And that's everything. So that's everything on the upper arm. So again, biceps brachii, brachialis, brachioradialis. I say those three together like that because they all kind of sound the same. But the rest of the upper arm is your triceps brachii. That's all the rest of this. Go back to the original position here, and once again, this is the anterior view here, biceps brachii. All right, so as we work our way this direction, we're going to see here we have our, you see how you have a larger, you got like a pair here. You got like a pair. So you have your extensor carpi radialis longus here, extensor, so here's that split, and here's your brachioradialis. So the very next one is your extensor carpi radialis longus. Why? Because it's on the back of the arm, you see? Posterior, here's your hand, here's the palm of your hand, here's the back of your hand. So these muscles all extend the wrist. So extensor carpi radialis longus. Why carpi? Because it goes to the carpals here. And why longus? Well, because this is the long one and this is the short one. So abbreviated, brevis. So extensor carpi radialis longus, extensor carpi radialis brevis. And then of course, yeah, and then the last word, why radialis? Because it's all on the radius. This is the radius over here, and this side is the ulna. Extensor carpi radialis longus, extensor carpi radialis brevis. Here, so we're going to skip these two pollicis going to the thumb. However, this one here is your extensor digitorum. This is your extensor digitorum because this muscle goes all the way down to the tips of your fingers, to your digits. So right down the middle there is your extensor digitorum. Just keep moving, keep moving. We're going to skip this little guy here, this 31. We're going to skip that little one. And the last one is, it's right up against your ulna, but it's still on the back of your hand. So we still call it an extensor. This is your extensor carpi ulnaris. Extensor carpi ulnaris. It's on your ulna. Now everything from here on out is a flexor. This is the palm of the hand, so these all have to be named flexor, or pretty much all of them. So just like this is your extensor carpi ulnaris, this here is your flexor carpi ulnaris. They have almost the same name, except one extends and one flexes the wrist. All right, and this is your, so this is the palmaris here, right down the middle, stops at the palm. If you remember this one here, this was your extensor digitorum, right down the middle, and it goes all the way down to the ends, tips of your fingers. Well, on this side, this is called your palmaris, and it stops right there. Palmaris. These muscles flex the wrist. These muscles extend the wrist. Extend. All right, very nice. And then deep to this, you see it here and you see it on this side. This is your flexor digitorum superficialis. Flexor digitorum superficialis. And the last one then, here's that split, that original split that we talked about. Here's the last one going around the forearm, is your flexor carpi radialis. And there's your thumb, flexor carpi radialis. Now you see you have this one here, and if I remove this superficial muscle, this is your brachioradialis. If I move this, look at this, you can see the rest of this muscle kind of crossing. And you can imagine what it does when it shortens. When it shortens, it pulls the arm like this. It pronates the arm. So this here is your pronator teres. That's your pronator teres. And this one here, if you see, it's actually underneath the pronator teres. This is your supinator. So when this thing shortens, it supinates the hand. So this is your supinator, and this one here is your pronator teres. When it shortens, it pronates the hand. Pronator teres and supinator. These are deep here. See, put this back, and all you can see is a little bit of the pronator teres. All you can see is a little bit of the pronator teres there. Okay. That completes the arm. And now we're back to the kind of back to the beginning. See that? We're back to the beginning. And this is the brachioradialis where we started. Okay, very nice. Now we have the now on to the leg. Here is the leg. This is the hip. Here's the knee over here, and down the leg. Here's your tibia, and all the way down to the foot. So this leg right now is looking, you know, it's as if you're looking at someone, looking at your patient. This here, this is your quad. I mean, these are your quads here, right here. Quad for 4. You have 1, 2, 3, and you have a muscle under here. That's 4. That makes it your quads. Well, this first one here is your rectus femoris. Rectus, just like your rectus abdominis. This one's upright. Rectus femoris. It's on the femur. And since this is the left leg, you look here. Okay, this is the left leg. So this is medial here. So this is your vastus medialis. and this is your vastus lateralis, and this is your rectus femoris, and then the last one is your vastus intermedius. So here is your vastus intermedius, and that makes the four muscles. 1, 2, 3, 4. All right, very nice. Here, this is your sartorius. Sartorius. That's your sartorius. And on the back side here, these are your hamstrings. You got three hamstrings here. You have one lateral, and you have two that are sort of ones on top of the other. Well, here's your biceps femoris, bicep, just like your biceps brachii. But this one is on your femur, so this is your biceps femoris. And then you have these two over here, semitendinosus, and this one is wider like a membrane. Over here, you see it here, and you see it over here on this side. This is your semimembranosus. Semitendinosus and semimembranosus. Okay, see that? You can see it kind of going all the way up there. It's hiding behind the semitendinosus here. All right, very nice. Gluteus maximus, here, gluteus maximus. And here is your gluteus, here's your gluteus medius here. And this muscle here, is your tensor fascia lati. Tensor fascia lati. This is your IT band, your iliotibial band here going down the side of your leg. This is your tensor fascia lati here. And then looking over here, so this is the inside of the leg here. This is the medial side here. You have here's your sartorius. We did that one, and you have these three right here. Well, the one that's 100% medial, like the most medial muscle here, this is your gracilis here, gracilis, and then you have your adductor longus and adductor magnus. Adductor longus, adductor magnus, and these muscles adduct, they add to the midline. These bring your leg back to the midline. You know, all of these do, but this is your gracilis. All right, very nice. And then going back to this model here, if we remove this, hopefully, yes, we can see it. Kind of just get rid of the small and large intestine here. Hopefully I can, here we go, remove this little guy. Okay, so this here, this is your iliacus. See, it's on the ilium there. Here's your iliacus. And then this muscle here, you see it? This muscle here, this is your psoas major. So all this right here is your psoas major. This is your iliacus, and these two merge to form your iliopsoas. Iliacus, psoas major, and then this is your iliopsoas right here. Very nice. Okay, and just a couple left, which is on the bottom of the, which is on your calf. Then there is another one, pectineus. There's another one, pectineus, and I don't believe it's showing here. Well, on the back, on the calf, then here's the back of the leg. Here's the back. Here's your knee there. Here's the back. There's your calf muscle there. So you got your leg. Okay, so this is your gastrocnemius. All that major, that big muscle on the back of your leg. That's your gastrocnemius. Gastro coming from, from stomach. It looks like a belly. And then deep to that is your soleus, which means fish. It looks like a little fish, I guess. So there's your soleus. Okay, soleus, and put this back. That's your gastrocnemius. And turn this thing back to the anterior view. Here's your tibia. So this here is your tibialis anterior. And that completes all the muscles. All right, thank you guys very much. That's a lot. You just rewind and, half speed, full, 1 and 1.25, 1.5, over and over. All right, thank you very much, and we'll see you again next time.